About 4.2% of adults in Kenya are living with diabetes, though many remain undiagnosed due to poor screening and health-seeking behaviors. In Kenya, diabetes is silently tightening its grip, affecting millions of lives across all ages and communities. Prevalence is steadily increasing due to urbanization, changing diets, sedentary lifestyles, and limited healthcare access. Diabetes has now become a national health challenge, draining families, overwhelming health systems, and threatening the country's social and economic fabric. Kenya spends 4.5 billion shillings annually on diabetes management.
My name is Florence Kamau, person living with diabetes, and got this condition in 2012.
This is a condition where there's either a lack of insulin or the insulin which is produced does not work properly. The main symptoms of diabetes are frequent urination in terms of frequency and also in terms of volume, extreme hunger in some individuals, extreme thirst. As diabetes accounts for 6% of the deaths. Therefore, you can see that this is a big burden in our country and even in the region and even globally. One of the main projects programs which is running at the moment, program supported by World Diabetes Foundation, which is being implemented in the 6 East African countries through the NCD Alliance of East Africa and the Non-communicable Diseases Alliance of Kenya has been a partner on this particular program. This again is looking at the prevention and control of diabetes, essentially looking at creating awareness of diabetes in schools, working with the media to also enhance the knowledge of diabetes in the country and specifically in educational institutions.
After knowing my condition, I happened to join a support group. And in this support group, which is Diabetes and Hypertension Campaigners, it is also associated with the NCDAC, who have worked very well in ensuring that as a patient, I understand how to go about knowing my blood sugars, my pressures, also my nutrition. They've been very resourceful to me as a patient in what that they have been training us, especially in nutrition. I've been able to manage my condition very, very nicely. In fact, I've been able to attend most of the training with my husband, who has been able to know how to live with me, how to support me, and it has been very, very helpful.
Through NCD Alliance Kenya, we have gotten a lot of support through capacity building. And capacity building is very important to us because it helps us build our knowledge and in turn builds our confidence when it comes to engaging the policymakers.
From the training by NCDAC on digital advocacy, I've learned a lot. First of all, I've learned that digital advocacy or content creation on health and NCDs is not just like posting video. No, it's all about strategic planning of messages. You first you look for your target audience. You draft your messages properly so that you can know where you are posting in terms of platforms.
These trainings are very important because most of us, we are youth advocates and we do not have the hands-on experience on how to engage with policymakers or even to go to the community and create awareness. But through these trainings, you gain a lot of insights on how to reach out to them, how do you communicate to them, in which language, and it has been great. We feel the impact of what we are doing from that. We as youth, we would love to even have like more youth being involved in matters to do with health, and when we talk as one voice, we even create a lasting change.
I really appreciate the trainings that I've received from NCDAC. They've been very, very helpful, and I wish if they can be extended to all persons living with NCDs, and even them that are not in this area of living with the NCDs. They may not be knowing. It's good to know your status, matters hypertensive and diabetes.
It's important for everyone to be screened, especially for adults to be screened. For one, get their blood pressure checked, also get their blood sugar checked. Of course, above a certain age, it's important for this to be done more frequently, but it's essential for people to understand that these are lifelong conditions, and you need to manage your condition once you're diagnosed for the rest of your life by adhering to the diet advice that you've been given, being physically active, stopping the use of alcohol, and stopping tobacco use if you use tobacco. And of course, remaining physically active. So, eat a healthy diet. Get your blood sugar and blood pressure checked on a regular basis, at least once a year, if you don't have diabetes and hypertension. This is the way that you'll be able to pick up these conditions in the early stages.